So I will talk to you about the implementation of the ERAS program in your hospital. I will talk to you about the management of the implementation, the organization, the clinical pathway and documentation, which are very important stuff, and the huge importance of an ERAS dedicated nurse. In our hospital, we start with ERAS in 2011. And we start to see what we do before ERAS. So we were here. So we had a compliance of 40% to the ERAS items. That's not very good. And then we do all the implementation. But how to put the theory into practice? That's the question. So you know this graph. It's important to have success to make a systematic implementation. It's very important because you have to be very straight in what you do. You need a team, you need regular feedback, a constant support from the ERAS Society and the team that help you to the implementation. And you need to organize the implementation. You can do that just as the last time. You have to prepare all your implementation. So there is 3 questions in the implementation. What do you want to realize? How to know if a change is better or not? And what are the changes to realize to get better results? So you have the Deming rule, the plan, do, act, plan, do, study, and act. So first, you plan your actions, then you put your actions, you do it. After, you study the results, and at the end, you act. So it will be some change you have to do to be better in your results. So you need to have clear goals for your implementations. You need a database and the audit system to know what you are doing. And with the result of your database and the audit, you can make some regular feedback and adjustments. And all that stuff is making with the ERAS team, of course. The difficulty for the interdisciplinary team is to have common goals. First, in general, in our hospital, you have all the staff, but the goals are not really common. With the ERAS team, you have the surgeon, the anesthetist, the nurses, or other person who is important in your team. And the most important thing is that you have common goals, and that's the success of your work. To have a good ERAS team, so you need a project manager, if possible a surgeon, of course. You need 1 or 2 more surgeons, 1 or 2 anesthetists. You need the nurse manager, and you really need an ERAS dedicated nurse. And that's I would say, the heart of your ERAS team, and that's the team that will implement all the ERAS protocol in your department. And if it's needed, you can have some other person, for example, administrative manager, financial manager, dietitian, physiotherapist, or whatever you think you need. I told you before that it's important to have regular feedback. So for that, you need to have data which are credible and exhaustive, that are fiability, of course, recent and valued by the surgeon. And with those data, you can allow to be estimated and compare what you do before and what you are doing with ERAS. And the evaluation must be repeated to assure the perpetuity of the change. And that is the challenge of the ERAS, because when you implement ERAS or whatever a program, for the first year during the implementation, you see the change, but after you have to follow with the change, and that it's the difficulty. You need also, as I said before, some documents, so the guidelines to have to put it in the clinical practice. You see the consensus ERAS guidelines, of course. You need to create the ERAS protocol, and we start to work with the clinical pathways. So you have three wheels that are in interaction all together. It's difficult to realize in that you need to adapt the consensus ERAS guidelines and the ERAS protocol to your institution requirements. And it's a very important thing to adapt. You cannot change all the things you did before. It's important for the people who are working not to change all the things, but to adapt to their practice. For example, in our hospital, we make some paper sheets for the patients. We give information in consultation. I see all the patients before the operation. We have an interview. I give them some information. I give them a paper sheet of information so they can read at home with their relatives too. They have the logbook to fill during the hospital, and they know all the goals for the daily hospital. We have a protocol for the anesthesia, and after we have a data collection. You need the data collection to follow your results, to have some good data, because you know that the manager wants to see all the data. You cannot tell them just our results are better. You have to see them, to show them, your data. So we have this kind of paper that the anesthetist, the surgeon, and the nurse have to fill, and then I take all the data to put it in the database. So the management of the program to have success needs three important points. The management with the support of your direction, the support of the department head chief and the nurse manager, of course. You need the interdisciplinary team because it's a multidisciplinary program. You need the support of the dedicated nurse. And you need three major other points. It's the hierarchical legitimacy, the clinical legitimacy, and you need to follow up. Concerning the management of the patient, before ERAS we had a segmented management, as I told you yesterday, and with ERAS we now have an integrated and standardized management of the patient and the participation of the patient. The patient is a real actor, he's in the center of his management. So after 1 year in my department, we were from the blue point to the green one. We have a compliance of more than 75%. We have less complication and less hospital stay. And that was for the result for the colorectal elective surgery. So when we do the implementation for the other hospital in Switzerland, we adapt to our country the concept from ERAS. We take about 8 to 10 months. We take together different teams that are interesting to start ERAS. And for the first month, they have to make some homework. They have, for example, to introduce in the database, for example, I ask for 20 pre-ERAS cases, and it's the first data they have to put in the database to compare after the progress they have. And during all the year, we have regular feedback with them. I am the support for the teams in Switzerland, and they have to, at the end of the program, they have to show us all the results with their progress. So, in summary, the ERAS essentials. If you want to be successful, you know that ERAS, well, we have less surgical stress, less complications, less hospital stay, and less cost. You need a dedicated team. You need the ERAS protocol. You need a good compliance, and the compliance is assured by the dedicated team. You need the audit system. with the audit system, you can analyze the results and adapt what you are doing and try to have better compliance. And with the audit, you can prove that you are successful with ERAS. Thank you for your attention.